At Health Committee today, it was very clear. The Liberals have no data backing up their decisions when it comes to lockdowns, restrictions, and hotel quarantines. We asked them, what is the data? What do you have that warrants these decisions that are having profound impacts on the livelihoods of Canadians, impacting their financial and their mental health? We asked the questions, we didn't get the answers. Take a look.
Maybe to Dr. Quash, if you can answer this for me, please, or maybe Dr. Polcan, either one. Another major concern with Canadians, I know all of us are getting, is the mandatory quarantine at hotels when returning home. Is there any data that backs up the fact that quarantining in these hotels rather than at home is reducing the spread of the variant in any way?
I'll defer that to someone else because this is really out of NACI's mandate, sorry.
Well, that's okay, thank you. If Dr. Polcan maybe can answer that.
So so what we are continuing to do with respect to understanding the spread of variants is to continue to update our suite of public health.
So as of right now, you don't have any data that proves that the hotel quarantining in hotel reduces the spread of the virus.
Thank you, Mr. Barlow. I'll let the witness answer, and then we'll carry on. Go ahead.
So at this time, we are continuing to update and monitor the impact of a suite of public health measures, including our border policy, on the impact on the spread of variants and the introduction of variants of concern into Canada.
So you don't know. Thanks. And,
Thank you.
I was really concerned with some of the questions that my colleague was asking at the beginning, that none of these assumptions, the impact of rapid tests or new vaccines have had on this modeling that was done. Do you think it's irresponsible to release these models to the Canadian public without including those assumptions as part of the process, at least to MPs and the media? Do you not think this is irresponsible?
Mr. Chair, the models that are presented represent an ongoing and a refinement of our understanding of SARS-CoV-2 as the science continues to evolve. And as we learn more about a number of parameters, including transmission, reproduction number, vaccine efficacy, these models are updated and are presented. The assumptions are available and are made available to researchers and to those that are interested, recognizing...
Sorry, Mr. Polcan, you only have a certain amount of time, and I appreciate that, Doctor, but Canadians are stressed. Businesses are closing, people are losing their jobs, and to have this information available to researchers, I think is irresponsible. This information should be available to every Canadian, and it should have been released with the modeling as background to where you're getting this information to the media and MPs here at this meeting, which you knew was going to be happening. I hope the representatives from PHAC here today understand how devastating these lockdowns are to Canadians, not only for businesses, but for Canadians' financial and mental health, which is being profoundly impacted. And the concerns that we're hearing is, just from today, is no data is being provided to warrant these lockdowns. So why isn't this information available that can warrant, that I can go and tell my constituents that the reason that you're being asked to lock down further is because of A, B, and C? Why isn't that information available?
Mr. Chair, on the issue of the changes in the outbreak dynamics and the impact of public health measures, as has been mentioned previously, there was modeling released today, which shows a number of different scenarios, including the maintenance of current public health measures. And the
Mr. Maybe I can put it this way. Sorry, I hate to interrupt, but maybe I can put it this way. When will you know? When will you have this? When can you put a timeline, and when you'll have the data sufficient to understand how many Canadians would need to be vaccinated before we have what would be acceptable herd immunity and no longer reasons for lockdown? When would you have that data available?
So that is, Mr. Chair, that is a question that is a moving question or a moving point as we learn more about the interplay of this virus. We continue to learn more on a daily basis about transmission dynamics, and now we have the additional layer of complexity introduced by variants of concern, which have different properties and different impacts on transmission. So these are live questions that continue to be updated and explored as we learn
what
more.
data shows that the model that's being used at the Calgary Airport is less effective than the quarantine hotel method? Anybody? Is there any data on that at all? Was that a political decision or a decision made from PHAC? Did PHAC advise the government, or did the government advise PHAC on the quarantine hotels? Did PHAC tell the government that we should be doing quarantine hotels? And if so, what was the data used?
Mr. Chair, I think that I may have indicated earlier that what we'd like to do is bring that data back to the committee, and we would undertake to do that.
I'm just asking because we've got the DG levels of most of PHAC here. Did PHAC advise the government to undertake the quarantine hotel measures, or did the government tell PHAC to make it so?
Mr. Chair, when we're looking at the prevention of the importation of COVID-19 cases, that would include the concerns that we would have with respect to the influence of the variants and the increases in the variants.
So quarantine hotels are more effective than the Calgary Border Pilot.
Ms. Rempel Garner, I would remind you that appropriate courtesy and fairness should be displayed when questioning witnesses. I
also know when word salad is being given to me.
Ms. Rempel Garner, I have the floor. I would request that you show respect to the witnesses and courtesy and let them answer your question. Thank you.
I'm also trying to show respect to the Canadian public, and I'm asking if PHAC advised the government on the quarantine hotel measures based on data that it was more effective than the Calgary Border Pilot measure, or if the government advised them to come up with rationale for this directive.
Thank you, Mr. Chair, for the question. What we can again reiterate is there's a need for a multi-layered approach with our public health measures. There's not one single measure which is going to work on its own. So the combination of effective quarantine for having the implementation of testing, we've introduced pre-arrival testing as well as a requirement for testing on arrival, and it's the combination of measures which is going to help us bring the pandemic under control. Thank you, Mr. Chair.
Table with committee the data on adherence to quarantine for the last year. Does that data exist?
Mr. Chair, we'd be happy to take that question back to the department and bring forward information with respect to adherence to quarantine measures that's available. Thank you.
Was that data used in informing the decision to make people quarantine at a quarantine hotel, which I note in the main estimates is going to cost $250 million? So what data was used to inform that decision? $250 million. What data was used? Anyone? I mean, it's just $250 million. I mean, what's that between friends, right? Anyone? Any data? No?
Thank you, Ms. Rempel.